Good evening, everyone, and welcome. We are at the APAP podcast. My name is Alanna Kavanaugh from the Professional Development Committee. Today is about how nurse practitioners and physician assistants can build themselves and move towards professional development. Joining me today is Susan Corbridge, April Kapu, and Ruth Kleinpell. And we are so lucky today to have these three individuals who are experts in this field. So can each of you join us and give us a little bit about your background?
Thank you so much for having us today. We really are appreciative to be here with the APAP community and looking forward to talking with you today, Alana. I am Susan Corbridge. I'm the Chief Education and Innovation Officer at the American Association of Colleges of Nursing, and I'm an acute care nurse practitioner. I'm Professor Emerita at the University of Illinois, Chicago, and for many years was a clinical professor in the Department of Medicine in pulmonary and critical care. In my current role at AACN, though, I just want to mention that I am here in my private capacity today. So no official support or endorsement from AACN should be inferred today. But thank you again for having me, and I'm so looking forward to being here.
Hi, well, I'll go next. I'm April Kapu. I'm a nurse practitioner, background in critical care. I am currently the Associate Dean for Partnerships and Global Affairs at Vanderbilt University School of Nursing. I'm also a practicing nurse practitioner. I've served in several leadership roles. I served as the Director of Critical Care to help build NP&PA practices at Vanderbilt University Medical Center for several years. And then I also served as the Associate Chief Nursing Officer for Advanced Practice for the Health System. And then more recently, I served in the capacity of President of the American Association of Nurse Practitioners. But today, like Susan said, I'm just here to talk based on my own experiences and hopefully be able to contribute to my fellow APPs.
Great, and I'm Ruth Kleinpell, and I am currently also at Vanderbilt University School of Nursing. I'm currently the Associate Dean for Clinical Scholarship. I am certified as an adult gerontology acute care nurse practitioner, and I started my nursing career off by working for 15 years as a bedside staff nurse in the ICU, and then transitioned to obtain my nurse practitioner and advanced degrees. And I actually was one of the first to take the national certification exam for acute care nurse practitioners at that time, and just was really interested in the role. So I've had the opportunity to publish and present over the years, and including the literature on nurse practitioners and physician assistants in critical care. So I'm delighted to be here.
Thank you. We are so incredibly fortunate to have the three of you here this evening. And so I guess we'll kick it off by talking about the power of leadership from the bedside and beyond. And so I'll pose this question to all of you, but anybody can kind of chime in. How do we help shift the mindset from I'm just a clinician to I'm really a leader?
Thanks. Well, I can start out, and then, obviously, I'd love to hear from my colleagues as well. We all continue to learn from each other over the last 25 or 30 years that we've worked with each other. So I, like Ruth, also started out as a critical care nurse, and ICU nurse was my first position, and I really was interested in that. And I think, looking back, one of the biggest things that I would take from that is I looked at leadership roles at that time as being really associated with positions, more administrative positions. And I didn't realize that actually, I was a leader at that time at the bedside, even in my role as a staff nurse with, everyone leads within their sphere of influence, right? And so thinking about really continuing that career up and looking at, first of all, what you bring as a clinician, and then continuing to grow and learn as we all continue to go on. So to me, I really feel that one of the biggest things that we can do is to think about, as a nurse practitioner in particular, and speaking from the NP perspective, is that nurses are great at systems change, right? So I think NPs in particular really sit at that unique position in the intersection of being, a clinical provider, as well as the patient advocate, as well as being an expert in systems change. So I think really looking at that perspective from leadership to me, I think is one way that we really can think about what we bring, and every single day we bring something as leaders to the table. So that's kind of how I would start. But I'd love to also hear from April and Ruth and their perspective.
Yeah, so I totally agree. There's not an APP that I haven't met that isn't leading in some way. APPs take on the challenge of representing not only themselves and their patients, but they represent one another. And they're fantastic at leading in whatever sphere of influence, as Susan said so well. It could be at the bedside as a clinician in their unit or at their clinic. They might be leading the launch of a new EMR. They might be presenting a lecture to their group, a journal club. I learned early on that I could just step up and help out. So whether I was creating an onboarding program, or I was writing protocols for our team, I think we just realized that we lead in our space as APPs. We're growing, and lots more people are looking to us to solve some of the challenges that are out there today. And so I think everybody has this tremendous capability to lead. I realized that I was much more of a leader in the outcome space early on when I started to question, like, how do I advocate for my team? How do I advocate for growth of our team? And I realized one powerful way to do that was not only to tell the story of what I did as a nurse practitioner in critical care, but also to be able to tell that story in terms of data. And that's where I came in touch with Dr. Kleinpell, Ruth, and away we went. And I have spent a wonderful career really focusing on outcomes of APP practice.
So I would add that by virtue of their knowledge and expertise, nurse practitioners and physician assistants lead in many ways, whether it's directing care at the bedside, whether it's belonging on a committee, whether it's driving a new protocol, whether it's implementing a new initiative. And oftentimes, APPs don't think of that as leadership, but it's really the building blocks. And once people realize that you are a professional, you are knowledgeable, you're reliable, you're dependable, you're a good communicator, those are all essential leadership skills. And oftentimes things will come your way based on your exhibiting your professionalism. So I have found that if you do a good job, you'll be asked to do more and serve in different leadership ways as well.
And I just like to add on to that a bit about, I think that is one thing that we can all do and really work to help new APPs that are stepping in is to, again, start out with a committee, start out with, leading a quality initiative, something on your unit even to increase your visibility, right? Because then, as Ruth said, that also then will get you asked to do more things and your leadership will really shine.
Great, thank you. And it's kind of funny. So the next kind of portion of this is about pathways to leadership, and you already hit on it a bit to talk about how does one pull themselves out of their comfort zone and lead, whether in early stages or a mid-career stage. How does one go about developing some of those tools?
That's a very good question. It is not uncommon for an APP to step up and say, I'm doing this or I'm doing that. How do I get formally recognized for it? Or how do I step up and step out of my comfort zone? I think it's just continuing to be the best you can be. If you're an amazing nurse practitioner or PA in the clinic or in the hospital, just continuing to be better and be better at your work, your craft, your what you really thrive on, what really brings you joy. And I think that really helps to set your compass. So if you are an amazing proceduralist, you love procedures, well, then that's where you lead. You have lower complication rates. You are an excellent educator to teach other people procedures. That's the space you're leading in. You might present on procedures. So it's really, what is your passion and your joy, and how do you follow that, and to make those next steps? And how do you come out of your comfort zone? I would say doing what you really do love to do. I think that just kind of pushes you, nudges you forward into those uncomfortable spaces.
Well, I would add that one way is really to step up and be involved, right? Volunteer for something. If a new procedure is going to be done that all the APPs need to know how to do, be the first one to volunteer to be skilled in that. So putting yourself forward as someone who wants to learn, who wants to lead, and you'd be surprised that once you do that, it comes naturally to step up to the leadership roles that may come and follow that.
The other thing I would add to that is that when you're looking for opportunities, but you might need a little help, either stepping out of your comfort zone or maybe finding them, reach out to other APPs who you see doing maybe are a bit more seasoned than you are, and reach out to them and say, I'm looking for opportunities, and hopefully that they will help with that. We all need to continue to help each other look for opportunities for others to raise them up, so we can raise our whole profession up. Both, as APP, that we can really help each other along. So, and there's nothing wrong at all with reaching out and asking for help and opportunities as well. And I love looking for opportunities for others. And I think it's one of the things that I always try to role model, because again, it's the way we all raise each other up. But also, don't be afraid to reach out and to ask for help and opportunities as well.
I totally agree. Honestly, there's my two mentors are on this podcast today. And I mean, I don't know how many people have talked to Ruth, and you're just telling a conversation about what you do every day. And she's like, did you write about that?
Right.
Did you publish on that? You really need to present on that. She would just draw those things out. And Susan, it's not uncommon. She sent me emails before. Hey, this is going on. Have you checked this out? So having mentors that like Susan and Ruth, where you can call anytime, but also mentors who see potential in you, and then you see potential in others. I think it's a give and take, creating opportunities and space to grow as a leader.
Can you think of a specific time, a mentor? April, you kind of alluded to this already. A mentor that has shaped your journey. Can you talk a little bit about that? How did you find them, and how did they shape that journey for you that made such a difference?
Well, I'll talk again since I was just talking about that. So, early in my career, I realized how important it was to collect data and to be able to speak to the outcomes of my practice. I've talked about this all the time. But I also realized early on that I needed more formal leadership training. So I decided to go back and get my doctor of nursing practice because I really needed some more formalized leadership skill in finance and macro systems, navigating, negotiating, working on more executive teams. And my whole focus was how do we add NPs and PAs to inpatient teams, and how do we speak to their value in terms of quality and finance as well. And someone put me in touch with Ruth, and I remember I was so nervous on that first call, and I was so worried my call was going to drop, and I could not believe I was actually speaking with Ruth Kleinpell, who had authored these amazing textbooks on outcome measures in advanced practice nursing. And that's really what started a career-long mentorship where she has encouraged me to step into spaces that I probably would not have without her encouragement.
And I'd like to add to that. So I was in the second acute care nurse practitioner class at Rush University in Chicago, and there were only, I think, a few people in the class before me, but Ruth actually started that program there at Rush. And so I was very fortunate to also have Ruth as a very, very early mentor, and, just to really provide opportunities. And Ruth has served as a mentor to me now since I first met her in that second class there back in the early 90s, or it was 95, in my acute care NP class. And The other piece of that too, Ruth also, was a great mentor in this regard, is that from very early on, we really learned the importance of interprofessional practice and teams. And even before people were really talking about that. And reaching out at the time, there weren't many of us. There were very few acute care nurse practitioners in the country. And so I had some fabulous physician mentors who, even I remember going to one initially and said, I need help with this. I need to, work on my clinical, I was working in procedures and I was doing clinicals. And he said, no one really knew about NPs at the time. And his response was, well, what's a nurse practitioner? And he said, but I'll help you. We will help you. We will. And they just embraced, the role. I ended up actually being hired there by them when I finished. So I think, again, reaching out to mentors, but not being afraid to have mentors. And we have mentors of all different types, right? And really embracing our teams as well.
I would say another important part is networking. I'd had many mentors over the years, and it's all because I attended a conference, attended a specialty group, networked and met people, shared my story, wanted to get involved, whether it's at a national conference or committee or work group. And that really opens the door to a lot of opportunities. And you don't need prior experience. It's just really something to be involved and to be present and to want to be involved is another key secret as well, to having a number of mentors in different components to help you along the way.
So, what's one thing each of you wish you had known early in your leadership journey?
I would say the wide, vast networks that exist of nurse practitioners and physician assistants. There are now quite a number of interprofessional conferences that have sections of APPs. There are APP organizations, and that it has really evolved. There's APPs, networking and publishing and working together on different project work. That did not exist when I first started in practice. So I would say it really is a way for other APPs to maximize the ability to, again, network and meet others to be able to form in different leadership roles.
Yeah, I would agree. I think there's some great opportunities within your own institutions, right? Again, within your sphere of influence and where you are, but really stepping up and saying, how can I increase the visibility of APPs? And again, making sure that we are continuing to move our professions forward in everything that we do. And then again, as Ruth said, the networking piece is just so incredibly important and also really fun as you move to network. And as we talked about earlier, not only is it is it's always I always feel that we need to, the people that have gone before us, we need to continue to learn from them and to gain networking through them as well, but also then, keep helping the ones that are coming after us too, to keep lifting our professions forward. So I think those networks are key. I would totally agree with that.
Yeah, I agree with both of those. And in terms of like a pearl of wisdom or something, there are so many things. If I could go back in time and tell myself, I would totally do that. One of those things would be listen more and talk less, and just really better understand the person you're speaking with and where they're coming from. And I think all of us that are on today, we're all have a background in acute care and critical care. And that's a certain type of personality. And I really was so comfortable in that world with everybody having a very similar personality, just, being very direct, upfront. And then when I moved more into a leadership role where I was having a lot of conversations with different people in different roles and positions, I realized not everybody has that same critical care mindset. And I would have told my early self, just listen more, really better understand the perspective of the person you're speaking with, and see where you can arrive at mutual agreements, mutual um, opportunities or solutions to move forward. I think that if I could tell myself anything, it would be that. And then the next one is that timing is everything. So sometimes you want something to happen and you think it needs to happen right away. and you want it to happen right away, but you have to say maybe now's not the right time. But then an opportunity will open up, and that big idea that you had unfolds perfectly because the timing is right. So I often tell people I work with on my team, timing is everything. So you've got a great idea. It may not be landing just the way you want right now. Maybe it needs to be worked out a little bit more, but timing will come into play, an opportunity will open, and that's when you need to roll out your ideas.
Such sound advice. Thank
Yeah.
you. What's one small action that NPs or PAs listening today could take away from this discussion today? How could they grow as a leader? What kind of pearl of wisdom would you leave them with?
Well, I think just realizing that they are leaders, that they are in their position because they moved from a level that they were at before into now a leadership position that is maybe at the bedside, leading patient care or leading teams. And so it's taking that first step, but realizing that they have a lot of potential to be involved in a number of leadership initiatives.
I would also say, piggybacking off of that, but to say if there's one thing that you can continue to do better every day, right? We all need to continue to on our growth journey. And I think, continuing to, you feel that you need to speak up more, maybe saying to yourself, I'm going to be sure that I'm more vocal in rounds, or that I'm going to volunteer to put together grand rounds, right? To participate. And so wherever you are, however you can continue to say, how can I get better and be better tomorrow? I think that's really important. And we all need to do that. So I know that's something that I try to work on every day. And that was sage advice that was given to me from one of my physician mentors many years ago as well. And it served me well.
Yeah, I totally agree. Even every single day, I'm trying to push myself into a new learning space, and I'm a novice in many ways every day. I might be a little bit out ahead on other days, but I do consider myself a lifelong learner, and I think that's very important. To both of my mentors' points, I think every step you take as an APP. First of all, you're an APP. Look at how much
Right.
you have done to become an APP, all the education, the training, the financial investment, everything you've sacrificed to get where you are today. That in itself is just a huge accomplishment. But every step you take, whether you're speaking with a nurse, or you're speaking with a physician, or you are volunteering for a committee, how do you give to that or do that better? So just constantly saying, tomorrow I'm going to have this conversation, and I'm going to listen more, or I'm going to just be more of a clinical leader in that space. So it's just step by step, and then realizing I'm a novice, you're a novice, we're all novice in many ways.
Thank you all for coming this evening, and thank you so much to our wonderful speakers, Ruth, Susan, and April. You did such a great job this evening and shared such wonderful pearls with us that we can take forward. If anyone is interested in getting more information about the Professional Development Committee, we are just kicking that off. And our plan is to really do more with research and publications, policy advocacy, certifications, and fellowship within professional organizations. Please be sure to like, share, and subscribe to support the podcast. And if you'd like more information, please email info@homeapp.com. Thank you so much for joining us.